Hello everyone, this is Professor Yusuf, and today we are going to expand upon the discussion that we had in lab about the muscles of the lower extremity and the abdominopelvic region. So let's just jump right into it. We're going to see a lot of terms that we already discussed and touched upon that we may have seen as well in the gross anatomy lab on the cadavers, and we're also going to see a few new terms. I encourage everyone who's watching this to not only focus on identification, proper spelling, of course, but also, of course, the origins, insertions, and the actions of these muscles. You are responsible to know all of the origins, insertions, and actions. Of course, you know, in addition to identifying these muscles, unless stated otherwise. Like for example, for the deep six muscles, you do not have to know the origins and insertions. You do, however, need to know the actions, which we will get through. And lucky for everyone, those muscles, those deep six muscles, all result in the same bodily actions. So we will get into those. Let's just jump right into our conversation by starting more proximally at the hip. Now we're going to work our way down through the thigh, the anterior, posterior, and medial compartment, and then we're going to pass even more distally past the patella into our shin muscles, and then eventually the ankle and foot. And I encourage everyone to pause if you have to, take a look at the different handouts that we've distributed over the past few weeks, and try to make the associations between the muscles, their locations, and their actions by intuitively thinking about why is this muscle moving the way it is. So take a look at the origins, the insertions, and try to see if you can work out the mechanics of those motions in a way that makes sense to you. Right? Okay. So let's move forward. So one thing that's going to be of particular importance, especially when it comes to muscles and knowing their actions, we got to be familiar with the different ranges of motion and their nomenclature, the proper nomenclature for all of these things. So we did discuss this already in class, and I demonstrated some of my famous dance moves for you up front, but we are going to try our best to use these diagrams to kind of visualize and think about what each of these different motions look like. The diagrams do a great job of doing that. I do encourage you to, in your free time, if you're standing up, try these out on your own, just so you got a general idea, and see in your head, try to feel out which muscles are being activated, right? Which muscles are you contracting to make these different motions happen. And it can really help to use your own muscular system as a reference, as a way of solidifying the knowledge into your brain, right? Different sources of information. It'll definitely help to kind of concrete that information into your mind. So, hip and thigh ranges of motion. So we know that flexion is going to be when we make the angle smaller, right? We're talking about the angle here between the torso and the leg. We're making that angle smaller. So as we are flexing, that angle is getting smaller, right? Think of it as you're kicking a ball, right? You're kicking the ball and the ball's flying. This, of course, would be the neutral position, right? We could imagine that this is the foot down here facing in that direction. And contrary to flexion, we have what is called hip extension. This is hip extension, right? So hip extension will be the exact opposite direction. We're making the angle larger, right? So as the leg goes further and further back, we get bigger and bigger angles, right? So there's flexion and extension. It is imperative that you are familiar with the difference. Why? Because a lot of the actions are going to involve flexion and extension of the hip. And this is just kind of a building off of the same concepts that we discussed on neck extension and flexion, trunk extension and flexion, right, of the back. So, you know, if you're not familiar with those yet, do go back to our previous lectures and try to reason through the different diagrams. And, of course, there are several resources online that I'm sure will demonstrate exactly what we're talking about. But back to the hip. So we covered extension and flexion. Now we also need to be very aware of what abduction is versus adduction. For those listening, we've already discussed a few ways that you can remember it. In case you don't remember, let me go ahead and just recap that really quickly. So when we're talking about abduction, abduction, we're talking about moving the limb, the extremity, further from the midline. So here's our midline, right? If we're talking anatomical position, this would be the midline, right down the middle, right where the umbilicus is, where we have our umbilical cord, the navel. You would have a line going straight down, separating the bodies into a left and right half. Abduction is taking whatever the limb is. It can be an arm, right? It can be an arm. It can be the fingers of the hand, or the toes of the foot. Abduction is moving away to abduct, right? So think of if you have like a flying saucer, right? An alien, and they send down the little beam, and they are abducting you. They're taking you away. They're taking you out into outer space. Abduct. So that's going to move the leg outwards. Leg's going to go further and further outwards, and that'll be abduction. Adduction, the way we remember this is add, right? You're adding them together. That's when you bring, instead of having your fingers all spread out like this, you instead would have them all associated close together, right? Adduction, adding together. You're bringing them together. That is when you're bringing two limbs together. If you're talking about your arms, that means you're bringing your arms toward the torso, as opposed to abduction, which would have your arms going further away, right? Okay, so I think we got that covered. Some more very important ranges of motion you should be aware of: internal and external rotation. So when we say internal and external rotation, these terms can also be substituted. We can also call them here. So for internal, we can also call that medial rotation. Excuse the handwriting. Just practicing for the future profession, right? And external rotation can be also classified as lateral rotation. By now we all know what lateral versus medial means, right? Medial is going to be more toward the midline. Lateral is away from the midline. So in this image here, we're looking at a foot in neutral position. When we talk about internal rotation, right, obviously this is the left foot. We can tell because we have the os coxa over here, the left os coxa. You can see that the pollex of the toe, right, you have the thumb, the big toe over here on the inside. That must mean that this is the left leg. So internal rotation would be moving our toes, pointing our toes toward the midline, right? So we would assume that the other leg is somewhere over here, right? And the person's body is over here, and they're smiling. Moving your leg, and most namely your toes, toward the midline. But we have to realize that when we move our toes in any direction, the patella and the femur are going to also follow in that very same direction to a very comparable degree, right? So we have internal rotation. That means our toes are going to be pointing in. Here would be the other toe if we were doing it in both legs, right? And they would be pointing inwards. If we have external rotation, as opposed to the neutral position over here, we would have the toes pointing out. You might notice that there's a lot more range of motion going internally than there is going externally. That's just the way that the foot is set up, so it's right there. But moving on, let's just talk about the final range of motion that we're going to talk about with regard to the lower extremities in the hip. And that's going to be the circumduction motion, which is essentially just a combination of the four that we just talked about: extension, flexion, abduction, and adduction, right? So you can just imagine your toe as kind of making a circle, just making a circle As you can see in the diagram over here, it kind of ends up looking like a cone shape, so to speak, that you're making with your leg, but that's just going to be a combination of these 4 ranges of motion that allow us to do that. Alright, so let's just move right into the first of the muscles that we're going to discuss today. Now, I do want to say that the majority of the muscles we'll be discussing are going to be on the posterior part of the thigh, right? And that means they're all going to probably have very similar actions, just like we saw with the forearm, for example, right? The anterior compartment that we discussed, the PFPF muscles, right? When you put that little trick, you put your thumb on the medial epicondyle, and then your digits 2 through 5 are going to represent different muscles on the superficial portion, right? The superficial muscles of the anterior compartment of the forearm, right? Peroneal teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. It's going to work very similarly in the thigh as well, right? All of those muscles in some way, shape, or form are going to function to flex, right? To flex the wrist or the hand at some point. And the same deal kind of applies for the posterior muscles. However, even though most of the muscles we're going to be talking about are on the posterior part of the thigh, there is this one muscle called the tensor fasciae latae, and that is actually the only muscle of the hip and thigh that would be considered a lateral muscle, right? Most of the other ones are going to be posterior, anterior, or medial, right? But this muscle, called the tensor fasciae latae, sometimes called the TFL, again, on the practical, you're going to have to write out the entire thing. Tensor fasciae latae sounds like a drink you could get at like Starbucks or something, but do whatever you got to do to help you remember the name. But TFL will not fly for the practical exam. But this tensor fasciae latae is kind of an exception. Again, it's the only lateral muscle that we really consider in the hips and thigh muscles. So let's just take a look. You can kind of see on the right, it has this kind of triangular shape. It's represented by green on the right, this triangular shaped muscle. And you can see by virtue of these 2 diagrams that it's going to traverse just anterior to the greater trochanter. Now remember, these bony landmarks that we talked about for practical 1, they're not going away. Right? We may not explicitly test you on what is this bony landmark, but we're definitely, it's definitely within reasonable fairness for us to ask you what is the origin, what is the insertion of this muscle, and almost all the time it's going to be some kind of bone or bony landmark. So we definitely would like that everyone is familiar. If you weren't too comfortable for practical 1, I would certainly go back and refresh your memory as we go through the different origins and insertions. So if we're talking about the tensor fasciae latae, we're going to see that it's going to traverse just anterior to the greater trochanter, and you can see that pictured over here. Therefore, due to that anterior placement, right, we're going to see hip flexion. This is going to be a hip flexor, and also because it's located on the lateral part of the thigh, it also is a hip abductor, abductor, right? So it's going to be a hip flexor because of the anterior location. It's going to be a hip abductor because of the lateral location, and also it's going to some degree do a little bit of hip internal rotation, right? Medial rotation, same thing. We can use either one interchangeably. So those actions again are going to be hip flexion, hip abduction, and hip internal rotation. I know that on the sheet that I handed out, the master sheet, it only says abduction and medial rotation of the thigh. Again, you only really need to list one of the actions, but it is important to understand kind of why these actions are taking place. We didn't include hip internal rotation in there, but if we're going by the book, it also is technically one of those actions that we should be discussing. Now, it's important that we also discuss this long, expansive tendon that's running all the way down the lateral portion of the thigh and ultimately inserting onto the lateral portion of the tibia, known as the Gerdy's tubercle, which we already talked about before the last exam, right? So here's our Gerdy's tubercle right here. That's going to be our insertion, right? And the tensor fasciae latae, which is separate from this tendon technically, even though it's an extension of this tendon, even though it extends into this tendon, I don't want you guys to get the impression that these two terms are interchangeable. That tendon is called the IT band, right? The iliotibial band. IT band is usually the more commonly used nomenclature in the field. I will accept IT band, but just as a rule of thumb, typically most abbreviations will not be acceptable on the practical. IT band is probably the only exception that I'm gonna really take on the practical, right? I don't want to see TFL for tensor fasciae latae, but IT band I will take. IT tract, you might hear it called. So yes, this long tendon is known as the iliotibial band, iliotibial tract, and you can see that although the muscle makes up the upper region, right, it's just that upper part that's the meaty portion of the muscle, right? That tensor fasciae latae is that meaty portion, it's the actual muscular tissue. It kind of is still an extension of that tensor fasciae latae, and that entire band of tissue allows you to better see how much femoral movement that muscle can actually have control over, right? That small little piece of muscle has quite a bit of control over the leg, the entire femur, right? The entire leg in general. And that is due to the expansive length of our IT band. So do try to get familiar. Again, these are not interchangeable terms. Tensor fasciae latae is not interchangeable with IT band. These are two separate things. IT band is the tendon portion, right? The tendinous portion. The TFL, the tensor fasciae latae, is that muscular portion, right? And the IT band will also serve as an insertion point for other muscles, like the gluteus maximus, for example, which we can see over here on the right side of the image. It's also going to be involved in different muscles, so that's another reason to keep in mind that these are separate entities. Now, moving forward, let's actually just go right into the gluteus maximus. And as we said before, there are going to be 3 different gluteus muscles, right? And this series of 3 muscles, even though they all begin with the term gluteus, does not mean they actually all do the same thing, right? So don't get confused, because they actually do have a little bit of a different action. So just to refresh everyone's memory, we have the gluteus maximus, the gluteus medius, and the gluteus minimus, right? Those words are going to be Latin derivations for maximus being the biggest, medius being the middle-sized, and minimus being the smallest, right? So the most superficial and the largest of the 3 glute muscles is going to be known as this gluteus maximus muscle, one of, if not the strongest muscle in the body. And it's called the maximus because it is the largest of the 3, and we can see it specifically represented here superficially by that yellow X. And then additionally, you can see it represented in the picture on the right by the green highlighted portion. And you'll notice that, like we said before, some of that gluteus maximus is going to actually insert into the iliotibial tract, right? Into that IT band / IT tract, whatever you want to call it. I'll take both. So it does have a little bit more of a lateral insertion as well, and that's going to be onto the gluteal tuberosity. So there can be multiple insertions, there can be multiple origins, multiple actions for each individual muscle, right? Which is one of the reasons that this exam gives some people a little more trouble than the others. There's just so much associated with each term on your term sheet, but if we look at it, we can see that there's the IT tract insertion and also that gluteal tuberosity insertion. Again, another important bony landmark, which we're going to see many of, and already have seen many of in our previous muscular discussions. So the glute max, I'm going to call it the glute max just quicker, but I expect everyone to write gluteus maximus on the exam. So the glute max, by virtue of its posterior location, right, it's going to make that a powerful hip extensor muscle. So it's going to do what we saw before. It's going to kick that leg backwards, bring the leg back behind the body, increasing that angle. So because of the posterior location, right, the rear, they call it the rear end for a reason, right, posterior location, it's going to probably qualify it as a powerful hip extensor. And also, if you can kind of visualize the angle of pull as it inserts laterally, right, into that gluteal tuberosity. So if those fibers were to shorten, we can kind of see intuitively, we could understand how there would also be an external or a lateral rotation of the hip, right? So if you think about kind of why this muscle contracting will cause external or lateral rotation of the hip, just think about where it is on the bone, right? Where is it attaching onto the femur, right? It's kind of wrapping around a little bit, and that means if that string gets shorter, right? If you think of the muscle as a string that's getting shorter, when that string gets shorter, it's going to kind of pull the side of the femur more toward the back, right? It's going to rotate it laterally. Your toes will end up pointing outwards more, right? I'm not going to get too into it. It's kind of difficult to explain without a live visual representation, but I'm sure you guys can picture it moving forward. Okay, so here is that gluteus maximus again. Here's another image, and we can clearly see the IT tract, IT band, right? We can see that the association with the gluteus maximus muscle. You can see that there's kind of this oblique orientation of the muscle fibers and the fascicles going from medial to lateral, kind of in a downward direction, right? This is important to recognize that. Obviously, it's the most superficial of the three gluteus muscles, but the orientation kind of gives rise to the actions, right? We can intuitively decipher what this muscle's contraction will do just by looking at the orientation, the origin, and the insertion. And it's important that you guys, train yourselves to kind of break down the mechanics of each muscle and understand why these actions are happening, because then everything kind of just clicks a little bit easier, right? And then we also have the gluteal tuberosity of the femur. You can see it over here. So if you picture these muscle fibers getting shorter, right, which is just essentially contraction, we can see how the thigh would rotate laterally. Okay, moving on a little bit deeper, so just deep to the glute max is a muscle called the gluteus medius. You can see it on the right here, represented in green. And if you look at the picture on the left, you can kind of see where the gluteus medius is represented underneath the yellow X, where the glute max actually overlies part of the gluteus medius, right? 'Right? So we can still kind of see the gluteus medius just superior to the gluteus maximus and clearly deep to it. Um, but beyond that, we can also see the gluteus medius just below it. Okay, moving on a little bit deeper, so just deep to the glute max is a muscle called the gluteus medius. You can see it on the right here, represented in green. And if you look at the picture on the left, you can kind of see where the gluteus medius is represented underneath the yellow X, where the glute max actually overlies part of the gluteus medius, right? So we can still kind of see the gluteus medius just superior to the gluteus maximus and clearly deep to it. But beyond that, we can also see that there's a very different orientation of the muscle fibers, right? Instead of moving more obliquely, right? Obviously now most superficial layer is going to come at an oblique angle right across the top, as you can see. So knowing that we have similar orientations, that generally are going to run in a very similar orientation, relative artist or the gluteal muscles, it's a little bit less of an extensor. Obviously now we're looking at a right. Okay, moving on a little bit deeper, so just deep to the glute max is a muscle called the gluteus medius. You can see it on the right here, represented in green. And if you look at the picture on the left, you can kind of see where the gluteus medius is represented underneath the yellow X, where the glute max actually overlies part of the gluteus medius, right? So we can still kind of see the gluteus medius just superior to the gluteus maximus and clearly deep to it. But beyond that, we can also see that there's a very different orientation of the muscle fibers, right? Instead of moving more obliquely, right? Obviously now we're looking at a right leg, because we know that the tensor fasciae latae and the IT tract, IT band are going to be on the lateral portion of the thigh. So assuming that this here is the IT tract, which it is, we're going to assume that's the lateral portion, which means this must be the right thigh, considering the fact that we're looking from a posterior position, right? So you can see that the orientation is more up and down, right? Kind of like what we'd see in a rectus muscle, in like the rectus abdominis, for example, or a few muscles that we're going to talk about that are coming up. And there's more of an oblique orientation in the gluteus maximus. So do take note of that. It could help with identification for sure. And similar to the gluteus maximus, it does act on the hip. However, because it's not directly located posteriorly, it's a little bit less of an extensor. So instead, the gluteus medius plays more of a role in hip abduction, right? And also a little bit of internal rotation of the hip as well. So the gluteus medius does hip abduction and also internal rotation. The glute max does hip extension and external rotation. And also of note, part of the function of the gluteus medius is actually to keep the iliac crest level with one another. So if you go into like a single leg stance, part of the function and action of this muscle is to prevent the hip from dropping as you go into a non-weight bearing position. You know, just a fun fact. I'm not going to test you on that, but do be familiar with the difference between the different gluteal muscles. And that actually brings me to the deepest and final of our three gluteal muscles, and that's going to be our gluteus minimus, minimus meaning smallest. So if you recall from the previous picture, the green area representing the medius was actually directly overlying the smaller gluteus minimus. So looking at the picture on the left over here, you can kind of see where the artist or the person who made this diagram is trying to demonstrate all three layers of the glutes, right? It tries to represent the relative orientation of the fibers of this muscle. And so the gluteus medius and the gluteus minimus generally are going to run in a very similar orientation. It's going to be one on top of the other, with the glute min being deep to the glute medius. And then, of course, the glute max at the most superficial layer is going to come at an oblique angle right across the top, as you can see. So knowing that we have similar orientation of the muscle fibers and pretty much identical location, right, we can intuitively think to ourselves, okay, these are in the same spot and they have the same orientation of the muscle fibers. They must be kind of doing the same thing, and they absolutely do, right? The gluteus minimus, just like the gluteus medius, is also going to be responsible for hip abduction, abduction, and hip internal rotation, medial rotation. So do keep that in mind. So let's move on to the next set of muscles. So these next 6 muscles we're going to look at are collectively known as the deep 6 muscles of the hip. If you look at your handout with that master sheet about which muscles are going to be tested on cadavers or not, you'll also see that there's in parentheses a little note saying that you only need to know the location and the actions, right? You just got to be able to identify and explain the actions of these deep 6 muscles. You do not need to memorize the origin and the insertion of any of the following 6 muscles. All we need you to know is the identification, the names, please emphasis on the spelling, as well as the action of these 6 muscles. So they are known as the deep 6 because collectively they perform the same function, which is going to be external or lateral rotation of the hip, right? These are naturally obviously quite deep in relative terms relative to the glute muscles, and we can kind of see that the deep 6 are going to be located just inferior to the gluteus minimus. So you would, in order to see them, you would kind of have to have visual access to the gluteus minimus, which, as we saw in some of the cadavers, is very possible, right? Some of the gluteus medius has been taken out, and the gluteus maximus can just be kind of flapped over to grant us visual access to the underlying layers. And yeah, so those deep six are going to be visual or visible if we look right below, directly inferior to the inferior border of our gluteus minimus, the medial inferior border. So, a little way to remember these, you may remember, it's not really a mnemonic device, but it's, a memorization device. We're going to think P, go, Q, right? We're going to think P, go, Q as our little way of remembering which muscles we're talking about. So from superior to inferior, P, go, Q. And this is working our way from superior down to inferior, right? And then somewhere up here we would have the gluteus minimus, right? And that's going to be directly associated with these deep six muscles. Which are all going to do the same thing, right? They're going to laterally rotate the hip. And that's all we need you guys to be able to recall for the exam. Don't worry about it, origins or insertions. Okay, so let's go ahead and look at these one by one very quickly. So here we have the P, right? The first muscle is going to be called the piriformis muscle. This is going to be one of the largest muscles, right? It's going to be this and the quadratus femoris that are going to be the largest of all of these muscles. So there's our P. Next we're going to have go, right? So we had P, go, Q. Disregard this title here because it should be talking about the next letter is G, right? We got piriformis, next is G, and we can see over here, if we look closely, that would be the gemellus superior, right? Now be careful, guys, because the P and the Q are their, those are kind of self-explanatory, but the G and the O of the two goes, right? Go, the G and the O, the G's and the O's stand for the same thing, right? Gemellus and obturator. So just be familiar with which ones come first. So the gemellus is kind of a little bit easier because it's going to be gemellus superior, which is going to be obviously more superior, and then we have the gemellus inferior, which is going to be more inferior. However, we have a muscle sandwiched in between the two gemellus muscles called the obturator internus, right? This is the obturator internus, as opposed to what we would call the other O, the obturator externus, right? And they get their names just from their relative orientation, relative to the obturator foramen. So we had the P, the two goes, and the Q, right? So we have starting again, the piriformis muscle, the gemellus superior, the obturator internus, the gemellus inferior, then here is the obturator externus that you can see in green, right? And then finally, at the bottom, the biggest one, the quadratus femoris. Remember, these quadratus muscles are going to have kind of a quadrilateral-like, rectangular-ish type of shape to them. And that covers our deep six. So the last few posterior muscles I want to talk about are going to be our hamstring muscles, right? We're going to have three of them. These are going to be biarticulate muscles, which means we're going to have these muscles crossing over two different joints. So therefore they're going to have actions on both of the joints that they cross. All of them have an origin on the pelvis, and they cross the hip, and they also have insertions down just distal to the knee, which means they're probably going to also have, definitely going to have an action on the knee. Right, so here are the names of the three muscles You have the biceps femoris, right? Biceps, by two, ceps coming from the word caput, meaning head, two heads. And just like we saw with the biceps brachii, right, in the arm, we have a long and a short head. And we'll get into those a little bit more detail in the next couple slides, but that's the first muscle. Next we have what is called the semimembranosus and the semitendinosus. And again, by virtue of their anatomical location, right? Their posterior anatomical location, they would be very powerful extensors of the hip. And also, because they cross over at the knee joint as well, they'd be very powerful flexors of the knee. Right? So they'll extend the hip and bend the knee, flex the knee, you should say. So definitely do be familiar with those differences. Right? Okay. Moving forward, here's another image that we can see. This is the hamstring muscle group. You get a better idea of what we're looking at in terms of the biceps femoris, the semimembranosus, and the semitendinosus. Now let's just talk about the biceps femoris a little bit more deeply. This first one, the biceps femoris, we've seen again the word biceps before, two heads, and the very expansive long head can be seen here. And then you have a little short head that emerges from the distal femur. It's going to insert onto the fibular head. So you'll remember that the fibula is the lateral lower leg bone. So therefore, the biceps femoris is pretty identifiable. And it's a very strong muscle because it's the only one that has an insertion onto the lateral side of the knee, right? In this case, the fibula. So if you look over here at the visual where the biceps femoris is represented in green, you can see its origin upon the pelvis. And then you can see where that short head comes in, and then there's that one common insertion into the lateral part of the fibula. And again, this action is going to be, for the biceps femoris, is going to be hip extension and knee flexion. And here we have the semimembranosus, right? And that is going to be more identifiable through relative terms. So we're going to look at the semimembranosus and the semitendinosus as kind of separate from the biceps femoris. And the way we're going to distinguish the two is by thinking of the semimembranosus, right? We're going to associate it with the word membrane, which is going to be more broad, more encapsulating, right? It's going to be wider, broader. A membrane is obviously wide and broad, as opposed to the semitendinosus, which we see over here, which is noticeably thinner, right? It has more of a tendon-like characteristic to it, right? And you may have to look a little bit more distally, a little bit more lower, closer to the patella, right, closer to the knee joint, to see the difference between the two very clearly. You can really see the difference all throughout the muscle, but it's extra noticeable down more distally by the knee joint. You can clearly see that one is much thicker than the other. And these muscles are going to make up the remaining two hamstring muscles, right? And finally, I have over here just a few images of some of the lab models that we have upstairs in the Allied Health room. And that's just going to be, this is what you can kind of expect to see on your practical. Now, again, you can pick up the models, you can manipulate the models with your hands and move them around, no problem at all. You may not touch the cadavers at all. So we expect you to kind of just look at what is pinned on the cadavers. Do not touch by any means at all. But the models, you're free to do whatever you got to do to be able to identify them. So here we can clearly see the gluteus maximus. We can see the semitendinosus and the semimembranosus, right? We can kind of see that the semitendinosus is relatively superficial to the semimembranosus, which is noticeably wider. You can kind of see it on both sides here. You can see on the lateral side the biceps femoris, right? The biceps femoris is going to be on the lateral side, so this is the left limb that we're looking at. If we were to remove the gluteus maximus, we can definitely see the gluteus medius a lot more clearly. The gluteus minimus would be deep to that gluteus minimus, or the gluteus minimus would be deep to the gluteus medius, excuse me. And then as we look a little bit more closely, we can see the more deeper muscle structures, right? So if we were to remove the semimembranosus, the semitendinosus, and the biceps femoris muscle, we could see some of the more anterior structures, right? Like the vastus lateralis, for example, which are going to be one of our quadriceps muscles. Here's another look from a lateral view. We can very clearly see that tensor fasciae latae muscle going into our iliotibial tract, right? We can also see the gluteus maximus associating with that IT tract, that IT band. We can see a small piece of this patellar quadriceps tendon, which we're going to talk about in a little bit. The biceps femoris, we can see the two different heads, right? You can see the larger head here, and you can see the short head over here. And just beyond here, you can see that semitendinosus muscle, which we said is going to be slightly more superior to the semimembranosus, which is why we can't see it too well. And then finally, we have this anterior view of the thigh muscles, which is going to contain quite a few of the important muscles that we're actually going to get into right now. So let's move right into the anterior and medial muscles of the thigh. On this slide, we're kind of just giving you a look of the thigh at different angles, different perspectives. This is going to be when I say the thigh, I'm talking about the segment of the lower extremity that is between the hip and the knee. So between those two joints, between the hip and the knee, there's going to be our thigh muscle. And if we take a cross section now, and don't worry, we're not going to ask anyone about cross sections. You're not expected to know this, but and I know Anatomy and Physiology Revealed does have some cross sections if you use like the quiz option or the quiz feature, but we wouldn't ask you any of that stuff on the practical. These images are simply to show you, and just to get you to understand how the muscles are oriented surrounding the bone in the thigh, which is of course the femur. So if we take a look over here at the slide, we can see it's quite a few muscles, quite a few pretty big muscles as well. You see all the fascicles and the bundles, and the way they're all lined up. And just like we saw in the other compartments, like we said, or in the other extremities, like we said, there are multiple compartments. There's the anterior, the posterior, and the medial compartment. We mentioned that the tensor fasciae latae is going to be really the only muscle that we're going to find laterally oriented. So let's just go right into it. We have these thigh muscles separated into three compartments. We have an anterior compartment, like I said, the medial compartment, and the posterior compartment, which we just talked about. And when we look at the anterior compartment, we're mainly going to be considering the muscles that we usually think of as our quads, right? Our quadriceps. The medial compartment is where we're going to find our adductors, right? Our adductors of the hip, and then the posterior compartment is going to be our hamstrings to help us with our extension of our hip. So this presentation is going to focus mainly on this portion of the presentation will focus mainly on the anterior and medial compartment, since we just did the posterior. And when we're talking about the anterior compartment, and we're talking about the quadriceps muscles, we're talking about knee extensors, right? Knee extensors, and also they're going to be our hip flexor muscles, right? So the quadriceps femoris is going to be, that's the formal name for the quadriceps. It's going to consist of the rectus femoris, the vastus lateralis, vastus intermedius, and the vastus medialis. So let's go into some of those first. Here in the anterior thigh compartment, we're looking at a right thigh, right? We always want to orient ourselves, and we can kind of see our os coxa up here. You can see this really long muscle, which we're going to learn about now. This is going to be our sartorius muscle. That sartorius muscle is called the Taylor's muscle. That's what it's referred to in the field sometimes, but it's going to allow you for some movement that's going to flex the hip and also laterally rotate the hip, and also abduct the hip. So that's going to be your sartorius muscle, and that's one that you can find handy if you're kind of sitting down like a tailor with your knee on your hip and you have externally rotated that hip. So here's your sartorius muscle, and it's really going to be the one that's dividing the anterior thigh, which are the muscles that you see from the medial thigh. And then we can see our four quadriceps muscles. First we see our rectus femoris. Okay, so this has an origin on the anterior inferior iliac spine, and it's important to keep in mind that those bony features could be on that practical exam. So do take note of that. Don't look over it. I know I said it 100 times, but it really is important that you guys take note of those bony features. So here in the middle we see that rectus femoris, right? Rectus meaning up and down. We see that with the rectus abdominis. And on either side, flanking that rectus femoris, we have what are called the vastus lateralis and the vastus medialis, with the lateralis being on the lateral side and the medialis being on the medial side. And these are all going to function to extend the knee, with the rectus femoris also having a function of flexing the hip. Right, so take a look over here at this chart, and you're going to see that the four quadriceps muscles all share the action of knee extension, with the rectus femoris also being in charge of some hip flexion. So if we go to this next slide, right, and assuming we've removed the sartorius muscle and the rectus femoris muscle, we can see the vastus lateralis and the vastus medialis nice, still just as clearly as we did before, but sandwiched in between those two vastus muscles, we can see the vastus intermedius muscle, which is here, and it's mostly tendinous, and we can see the quadriceps femoris tendon, or the quad tendon down here. It's going to be that common insertion for all four of these quadriceps muscles. So when we remove the rectus femoris, then we get a really clear look at the vastus intermedius, right? So because it's deep to that rectus femoris. So moving on, we're going to just skip these next couple slides. They kind of cover what we just talked about. So now we have another muscle in the anterior thigh compartment, and that's going to be the continuation of two muscles that are originating from within the abdominal pelvic region. And the two muscles that are being combined are the iliacus and the psoas major muscle. And those two muscles are going to travel into the thigh, so past the inguinal ligament, and then they become a single muscle, which is called the iliopsoas muscle. All right, so the psoas major over here and the iliacus muscle are together going to come to form the iliopsoas muscle in the thigh. Right, and we're going to find that iliacus right here in the iliac fossa, and this iliopsoas muscle is going to be a major hip flexor of the thigh. Also, the psoas major is going to be a postural muscle as well on its own. So then the iliopsoas muscle is also going to be a lateral rotator of the thigh. So let's move right on to the medial compartment, so you get a little bit more oriented with the image. So what we're seeing here are going to be those hip ligaments that are running between the different parts of the femur in order to stabilize the hip joint. You can see your psoas and your iliacus muscles here. You can see some of those quad muscles from within the anterior thigh. But then we're going to focus our attention to this medial thigh. And as I said, the medial thigh is usually thought of as the adductor, adductor compartment, because so many of these muscles are adducting by bringing the thigh back to the midline, assuming it's been abducted already, right? So here are some of those muscles that we can see here, and there's still some more that are going to be deep. But starting from the more superficial medial muscles, we can see our pectineus muscle. So this one is going to be the more superior muscle of the medial compartment of the thigh. Here is a smaller muscle called the adductor brevis, and that's going to lie just superior to the adductor longus, right? So adductor brevis will be superior, adductor longus will be a little bit more inferior. And brevis and longus are terms, obviously, that should ring a bell. We have these muscles found in the upper extremity, where we had muscles like the extensor carpi radialis, longus and brevis. Longus and brevis just referring to the length of the muscle. So this is going to be the short adductor of the thigh, the adductor brevis, and then the long adductor of the thigh will be the adductor longus. And then finally, the most medial muscle found in the medial compartment of the thigh is going to be our gracilis muscle. Okay, so we can see where that is originating. It's originating on this pubic tubercle. And this is going to be one of the 3 muscles that are inserting onto the pes anserinus muscle. Okay, and then if we remove the adductor longus muscle, that's going to allow us to see a little bit more of the adductor brevis, right? And then also the largest of the 3 adductor muscles, which is going to be our adductor magnus. So the large adductor of the thigh, right? Magnus means big, large, longus and brevis, long, short. So if we take another look, we can also see the obturator externus over here, which is one of our lateral rotators that we talked about, one of those deep 6 hip muscles, right? And then again, we removed the pectineus muscle just in order to see this view, so you can see what we're seeing in this image over here. Okay, so just to wrap up the medial thigh compartment, let's talk about what these muscles do. So your pectineus, your gracilis, and all of your adductor muscles, adductor muscles, right? So that would be your adductor brevis, adductor longus, and adductor magnus, your hip adductors. And then our obturator externus as well. That's going to be a lateral rotator of the hip, right? So the pectineus, gracilis, and all your adductor muscles are going to be hip adductors, and your obturator externus is going to be laterally rotating your hip. And that wraps it up for our thigh compartments, the anterior, medial, and posterior thigh. So at this point, let's just jump right into our lower leg muscles. So we're going to discuss the muscles of the lower leg and the foot and the ankle. So as we go into these, the first thing I want to do is just review those foot and ankle motions that we're going to discuss with our muscle action. So at the ankle, we're going to have a couple motions to discuss, and that first one is going to be flexion and plantar flexion. So if we recall, dorsiflexion is kind of bringing those toes and ankle up towards the face, right? So up and decreasing that ankle, flexion. And that's going to be the dorsal aspect, right? So the dorsal aspect is we're bringing that up more toward the body. Plantar flexion is going to be pointing the ankle and toes downward, right? Like we're pressing on the gas pedal of our car. So those toes go down again, more toward the plantar aspect from that kind of neutral position. So we get dorsiflexion and plantar flexion, and then our other 2 motions are going to be what are called inversion and eversion. So inversion is going to be when we're pointing our toes inward or more medially, so toward the midline. It'll be like kind of the opposite of swinging the foot out more laterally or away from the midline. We'll also see a couple motions of the phalanges that we need to discuss, excuse me, and that's going to be flexion and extension. So again, kind of curling the toes, bringing the toes more downward. That's going to be toe flexion, and then bringing the toes up again, right, pointing them upwards, more toward the dorsal aspect, is going to be phalangio or digital extension, right? So now that we have those done, I want to discuss how we break up or categorize the lower leg, right? We've broken up all of our extremities so far. The forearm, the upper arm, the thigh, right? So the lower leg is also going to be broken up into compartments. We're going to break this one up into 4 compartments, and as we can see those listed here on the left, we have the anterior, the lateral, and then the deep and superficial posterior compartments. So let's kind of start in the middle, this middle image here. We can kind of see that this is a cross-section of the lower leg. So if we take that slice, so we're looking down, same thing like we did before, we can see the relationship of the tibia and fibula with the rest of the muscles. And we can see on that medial side of the tibia, right, that bony portion is the tibial crest, right? And there's not too much going on there. But then surrounding it is in this like kind of big C shape are those muscle groups or compartments that we just discussed. And we see it again here in the image on the left, which is just really just showing the anatomically what's going on. So over here, the red's going to be our anterior compartment, blue is our lateral, our green is our deep posterior, and we can see that that's covered up quite a bit by our superficial posterior compartment. And we'll discuss how those work and how those layers work in just a little bit. But again, just the muscles in particular are listed out again with each compartment facing kind of forward is the anterior, the deep, and the superficial is the posterior, and then you also have the lateral compartment. And again, we'll hit each of those muscle groups and the individual muscles. But one more time down here, I just want to show you guys the cross-sectional view because it's really important because again, it's going to give us a good understanding of the different layers, right? This gives us an understanding of the superficial versus the deep layers of the different compartments. And also, if we look at the image on the right, we can find this on one of our models in the lab. Actually, we have two of these ankle models. So make sure when you're in the lab, you're familiarizing yourself with these. So, we can see again each of these individual muscles and those compartments now labeled on the right with our muscle model. So we can see here with the yellow arrow, here's our anterior compartment. Lateral is going to be your green arrow. Superficial posterior is the blue, and deep posterior is the red. So again, use those bones that you already know to kind of help you out, right? So the tibia is obviously going to be more medial, fibula more lateral. So if we're just off of the fibula, that's going to be our lateral compartment, and then for in front of the tib fib, that's going to be our anterior compartment. And if we're behind or posterior to the tibia and fibula, that's going to be our deep and superficial posterior compartments. But yeah, I definitely encourage you guys, please do use the models in the lab. They definitely are going to help with getting yourself familiar and more oriented with the different orientations. Okay, so let's take a look at the first compartment, which is going to be our anterior compartment. This is going to have 4 different muscles within it. So again, we have that little cross-sectional view up here, just to reiterate where we're looking. So we're looking in front of that tibia, right, and a little bit lateral to it. So as we look at the individual muscles, we're going to start on the left here with the extensor hallucis longus, right? So our extensor hallucis longus, we can see, is coming from kind of like the middle third or middle portion of the fibula, crossing over the ankle joint, right? And it's going to run all the way down and insert into the dorsal portion of the distal phalanx on the first digit. So when we talked about the hand muscles, we use the term pollicis, right, for the thumb. When we're talking about the foot, we're going to use, instead of pollicis, we're going to use for the big toe or the great toe, we're going to use the term hallucis now, or hallucis, right? So again, that muscle's coming from the fibula, that little middle third of the fibula, and down into the distal phalanx of the first digit, the big toe. Alright, so now onto this next image. The second image here is our anterior tibialis. You might hear anterior tibialis or tibialis anterior. Either order is acceptable there. But our anterior tibialis is going to come from, it's going to originate from our lateral condyle of the tibia and kind of run down the rest of that lateral surface of the tibia. Again, it's going to cross the ankle joint and make its way down. It's actually going to run underneath the foot and insert onto the plantar aspect. So we're looking at the bottom of the foot. It's going to run into the plantar aspect from the first metatarsal and the first cuneiform. Right. So again, this one runs very deep underneath the foot as it runs across the foot and ankle here. Our next one is going to be our extensor digitorum longus. Right. So again, just like we saw with the hand, digital or digitorum is going to be digital. We're talking about the toes here in this case instead of the fingers. And so as we look at the extensor digitorum longus, we can see a little bit more of a lateral insertion off the fibular head and the lateral tibial condyle here, right? And so that is going to then run down, and it's going to divide into 4 different tendons that go into, again, the dorsal aspect of the distal phalanx of the toes. That's going to be 2 through 5, right? Extensor hallucis longus is going to be for digit 1, the big toe, and the extensor digitorum longus is going to be for digits 2 through 5 at the distal phalanx. And then finally we have a bit of an outlier, and that's going to be the peroneus tertius. So tertius means third in Latin. So primary, secondary, and tertiary is the order. So the tertiary is a third of the peroneals, and we'll see the other 2 in a moment. But this one, we can see it is originating more from the distal third of the fibula. It's going to run through that anterior department and is going to insert onto the base of the 5th metatarsal, right? So again, the base of the 5th metatarsal here is going to be your origin, or the insertion, excuse me. And we can see on this other image over here, all of those overlaid on one another. So we can't see in this last image, this one all the way to the right, we can't really see the peroneus tertius. You can also say the fibularis tertius. Both are used, they're interchangeable. You can use whatever one you like. You can't really see that peroneus tertius though, because it's running deep to many of these other muscles, right? And then it's going to kind of sneak out and peek into that 5th metatarsal there. But we can't see, we can definitely see the anterior tibialis, the extensor hallucis longus, and the extensor digitorum longus without a problem, right? And again, it's going to be coming out between those tendons and then running down into the great toe. So I know I haven't mentioned the actions yet for these, but all of these are going to have pretty much one common action that they're going to do. Dorsiflexion is really going to be the common denominator here, right? So they're running in front of our ankle joint or anterior to our ankle joint, and that means as they contract, they're all going to pull the foot and ankle and toes up towards the face. And that again is going to be dorsiflexion, right? So all those muscles of the anterior compartment are going to be ankle dorsiflexor muscles, right? So those are really the primary actions that we're going to see for these 4 muscles. But I do want to take a second and just kind of jump into some of these secondary actions as well, right? So if we look at the anterior tibialis, right, we can kind of see that the tendon of the anterior tibialis is crossing the ankle a little bit more on the medial side now, right? So that means that this is not only going to dorsiflex, but as this muscle contracts, as the anterior tibialis contracts, it will also invert the ankle, right? It's going to invert the ankle. It's going to bring those toes inward toward the midline. So that anterior tibialis is going to be a dorsiflexor and an inverter muscle, okay? So that covers the anterior tibialis. So now I want to kind of jump over into the peroneus tertius, right? Fibularis tertius, however you want to go about it. They're both acceptable. This one's a little bit more obvious, right? So contrary to what we saw with the anterior tibialis, we can see again that now the tendon tends to run a little bit more on the lateral side, right? On the lateral side of the ankle. So that means that the peroneus tertius, right, is going to do a little bit more. Instead, it's obviously going to do the dorsiflexion, right? But it's also going to do some eversion, which is bringing those toes out, or more away, or more lateral, away from the midline. So we're kind of looking at where those tendons are going to cross the ankle again. All 4 are going to be crossing, obviously, the anterior portion of the ankle joint. They're all going to be anterior, hence the dorsiflexion. But some of them are going to cross more medial, some will cross more lateral, right? So the medial are going to be inverters like our anterior tib. Some are going to be crossing more lateral, right, like our peroneus tertius muscle. So if you look at the extensor hallucis longus, extensor hallucis longus, however you want to say it, this main action is going to be, yes, to extend that great toe and to help with dorsiflexion of the ankle, right? But it's also going to help to slightly invert a little bit. But again, the main actions are going to be dorsiflexion and great toe extension, of course. But there is a little bit of involvement in terms of some inversion, right? So this is also an inverter. And then our extensor digitorum longus, again, is going to aid with dorsiflexion as it crosses the ankle, but it'll also, beyond that, obviously extend digits 2 through 5, which is, a separate action. But additionally, more of a secondary kind of action is going to aid with some eversion. So it's going to be extension of digits 2, 3, 4, and 5, and eversion as well. Plus, of course, the dorsiflexion. So those are just the 4 muscles of our anterior compartment, all with their main action, or their common action, being associated with dorsiflexion, and then you also have their individually associated actions, which are a little bit more secondary. So let's make our way into the lateral compartment now, right? The lateral compartment. So we can see this cross-section popping up again. We just did the yellow portion, the anterior compartment. So now we're going to work all the way over here to this greener portion of the cross-section, right? It's going to be right off to the side of the fibula on the very lateral portion of the lower leg. And here in this compartment, you're only going to have 2 muscles to know. And these are names that you are familiar with by now. These are the cousins of that peroneus tertius we talked about, right? The fibularis tertius. Again, they're interchangeable. Peroneus and fibularis are both interchangeable. For any of these 3 perineal muscles, right? So we have, in the lateral compartment, we have the peroneus longus and brevis. Again, there are 3 total of these perineal muscles, and only 2 of them are going to live in the lateral compartment, and we're going to have the tertius up there in the anterior compartment, right? So we can see from this image, the peroneus longus is going to originate from the fibular head and the proximal portion of the fibula. It's going to run straight down, and again, this one is going to, if you look at the tendon, it's going to go behind our lateral malleolus. Here it runs all the way again across the bottom of the foot, right? So if we're looking at the middle image now, this is going to run from that lateral compartment, just like we talked about with the anterior tib, right? It's going to cross underneath the bottom of the foot, again going to that first base of the first metatarsal and that first cuneiform. So that's going to be our peroneus longus, or our fibularis longus muscle. Now our brevis, again, which means short, it's obviously going to be a shorter muscle, and that's going to originate from the lateral portion of the fibula again, but this time in the mid portion, or the middle third of that fibular shaft. And it's going to run down behind that malleolus here, behind that lateral malleolus, right, just like the peroneus longus. But this one is actually going to stop here and insert onto the styloid process of the 5th metatarsal, right? So again, the peroneus longus runs all the way underneath, goes into the first metatarsal, and the peroneus brevis stops here and inserts at the styloid process, that pointy process of the 5th metatarsal. All right, so again, these are going to be both lateral compartment muscles, and we know they're going to be sitting lateral to the joint here, so that means all of these, or rather both of these, are going to help evert the foot, right? So these are going to be the everters of the foot. They're also going to aid against, since they're now going behind where the ankle joint is, that talocrural joint sits, right? So they're also going to aid with plantar flexion as well. So it's going to help to bring the foot and ankle down, pointing it down like we're pressing on the gas. Alright, so now as we move onto the posterior side, we have 3 muscles that we're going to be concerned with in the superficial posterior compartment. And those are going to be the gastrocnemius, the soleus, and the plantaris muscles. All right, so as you look at our individual images here, the one on the left is the gastrocnemius, and so the gastrocnemius is a muscle that has a couple distinctions that we want to talk about. First of all, it's a two-headed muscle, right? It has a medial head and a lateral head. So remember, I can tell from this view in a couple of ways which side's medial, which side's lateral. First, I can see the great toe here, right? So the first digit is over here, and that tells me it's medial. Or I can look at the malleoli, right? I can see the lateral malleolus is sitting a little bit lower than this medial malleolus. So that's a good way to indicate that we're which side we're looking at, medial or lateral. So again, we've got two heads, medial head and the lateral head, and they are going to originate from the medial epicondyle of the femur and our lateral head from the lateral epicondyle of the femur. So the medial is going to be coming from the medial epicondyle and the lateral head from the lateral epicondyle. And these are going to come down. They're going to converge into this piece of soft tissue that we've already discussed called the Achilles tendon, right? So the Achilles tendon, something we've all probably already heard of, is going to then insert onto the posterior aspect of the calcaneus, right? So again, that's going to be running from the femur, from the femoral epicondyle, right, for each head, converging down into this large tendinous portion called the Achilles tendon. Now, because the gastrocnemius crosses two joints, right, it's going to be a biarticular muscle. We've heard this term a few times already. And it's going to have actions at a couple of different areas. So first, proximally here, since it crosses the knee joint posteriorly, it's going to help with knee flexion, right? And then since it crosses again over here at the ankle joint, it's going to do some plantar flexion as well. So this is a very nice, powerful muscle. So any activities that involve jumping, right, or pushing off are going to definitely involve the gastrocnemius. It's a very important muscle in terms of creating powerful plantar flexion here. So again, large two-headed muscle running down and plantar flexion of the ankle is our gastrocnemius. Now, sitting just deep to that, so if I look toward the left image over here, right, what we're looking at now, in the yellow here, we cut out the gastrocnemius, right? And it's been cut away, so we have this green soleus muscle that sits here and is kind of sandwiched in between those two is those little that little purple plantaris muscle. So you can kind of see the plantaris is kind of in between the two heads of the gastrocnemius, more proximally, and then it extends down above the soleus, right? So again, we're looking deep to this gastroc over here, the gastrocnemius. We're starting with the soleus muscle, and this soleus muscle is very, very similar to the gastrocnemius. However, notice that it does not cross the knee joint like the gastrocnemius does, right? So the soleus is actually going to originate from kind of the upper third, the proximal third of the posterior aspect of the tibia and fibula, and so that's going to run down. It'll have a right across that large myotendinous junction and run down into the Achilles tendon again, right? So now, since we're not crossing the knee joint, that means that the soleus only does plantar flexion. It has no action or responsibility at the knee. So the gastrocnemius does, because of those two heads cross the knee joint, right? But the soleus does not. It's only a plantar flexor, right? And again, it's a relatively powerful one. It's a relatively strong plantar flexor at that, but again, running into the Achilles tendon, inserting into the back of the calcaneus muscle, bone. And finally, we get to this very small plantaris muscle here. It's kind of an accessory muscle. We see a very small muscle belly here, and again, it's originating from the lateral epicondyle of the femur. Very, very small muscle belly and a very long, thin tendon here. And that is going to insert as part of the Achilles tendon as well. So all of these three muscles are going to converge or go into the Achilles tendon, right, which is going to insert into, again, the posterior portion of the calcaneus. And so technically, our actions here, right, for the plantaris would be plantar flexion again. And remember, now we can see that this one is crossing the knee joint. So technically, it would also be a weak knee flexor. But again, really, most of the responsibility for plantar flexion falls on the gastroc and the soleus. The plantaris would be what you'd call a weak knee flexor, right? And this is often an area that actually gets used for the grafting of the tendons on people, right? If they have reconstructive surgeries or something in their elbow. You might have heard something called Tommy John surgery, right? And what they'll do sometimes is take this plantaris tendon and use that tendon to recreate the ligament that has been torn. So anyway, in terms of its muscle action, again, it's a weak knee flexor and a plantar flexor, but it's very, very weak at that. We don't use it for too much. So when we take it out, it's not really missed. We don't really miss it. But again, this is our superficial posterior compartment comprised of those three muscles. So moving away from the more superficial layer of the posterior compartment, if we peel away the gastrocnemius and the soleus and the plantaris muscles, now we're in that deep posterior compartment. So as we look at these muscles individually, we're going to have three muscles of the deep posterior compartment. That's going to be the posterior tibialis, the flexor hallucis longus, and the flexor digitorum longus, right? And we're not going to discuss up here the popliteus muscle, you can see on the right, but these three muscles, you might notice they sound very similar. They sound familiar, and you should have a little bit of a light bulb going off that they sound kind of like the reverse of what we saw in the anterior compartment, right? Same thing, but just reversed. So we used to have in the anterior compartment the anterior tibialis, the extensor hallucis, and the extensor digitorum. But now that we flip sides, we're on the posterior side. That means we're on the flexor side, right? So now we have the posterior tibialis, the flexor hallucis longus, and the flexor digitorum longus, right? So beginning with the posterior tibialis, or tibialis posterior, whichever way you want to, either order is acceptable. This again is going to have a long run. It's going to come right off from our posterior aspect of the proximal portion of the tibia and fibula. Have a nice long muscle. It's going to run down and insert into a few different areas, including the navicular tuberosity, as well as several branches that are going to run into the cuneiforms here. So to all three cuneiforms, as well as the bases of the second, third, and fourth metatarsal. So this is a muscle that has a wide insertion point, or a very tendinous insertion point onto several spots, but its main one is going to be on that navicular tuberosity, among others. So this tibialis posterior is going to really help. Again, this is posterior, right? So it's going to help with plantar flexion, and it'll also aid with some inversion, because again, you can see that tendon here is crossing on the medial side of the ankle. So again, the posterior tibialis is going to be a plantar flexor and an inverter. So as we continue through, we're going to take a look here at our flexor hallucis longus, flexor hallucis longus, and this muscle we're going to see is going to be coming from the posterior middle third of the fibula. Right? We know this is the fibula because this is the medial side, this is the lateral side, right? So this must be the fibula. So this is going to come from the posterior middle third of the fibula and then run down into the plantar aspect of the distal phalanx of the first digit, or the first toe, right, the hallucis. So that means, right, if we are on the distal phalanx of the first digit, on the plantar side, that means, again, this is going to help with some dorsiflexion of the ankle. But again, its main job is going to be to flex that big toe down. So to curl that big toe down for us. And then finally, we have our flexor digitorum longus, right? Our flexor digitorum longus is going to split. It's going to split, but our origin here is the posterior aspect of the middle third of the tibia. Again, running down on that medial side to be split. And finally, we have the flexor digitorum longus, And again, similar to our extensor in terms of the insertion point is going to be split. It's going to split, but our origin here is the posterior aspect of the middle third of the tibia. Again, running down on that medial side and the posterior aspect of the ankle, then dividing into 4 tendons, and this time going into the plantar aspect of those distal phalanxes of the 4 digits, right? So 2 through 5. And that's going to help a lot with flexing the digits, this 2, 3, 4, and 5. Whereas the flexor halicus, right, that's going to, flexor halicus longus is going to flex that first toe specifically, right? So since these are all posterior muscles, they're going to aid with plantar flexion. Right? So we will definitely want to keep that in mind. And that pretty much covers it for our muscles of the deep posterior compartment. We have another view over here, in this little middle image, where we could see all 3 of the tendons. And you might hear the acronym kind of thrown around occasionally, called Tom, Dick, and Harry. Those are meant to signify the deep posterior compartment muscles, or even the anterior compartment can do this as well, actually. So Tom, Dick, and Harry, it's supposed to lend itself to the names of the muscles here. So for the posterior compartment, the Tom would be the tibialis posterior, Dick would be the flexor digitorum longus, digitorum, right? And then Harry would be the halicus longus, flexor halicus longus. This can apply to either the anterior or the posterior portion, right? So it's just, you know, a little fun way for a lot of people use to kind of remember those muscles. So definitely take the time to look in the lab. We have leg models in there. Do take the time to get into the lab and look at the lower portion of the leg muscles. If we look here on this image all the way to the right, we can kind of see the general orientation. You have the tibialis posterior that's going to be kind of sandwiched in between the flexor digitorum longus and the flexor halicus longus on either side. You're going to have your digitorum longus more medially placed, and your halicus longus is going to be more laterally placed, with the tibialis posterior sandwiched deep to the 2 of those. And it's still visible, but it underlies these 2 lateral and medial muscles, right? The flexor digitorum longus and the flexor halicus longus. And that about covers it, guys. So thank you for watching. Do make sure you get that time in the lab, and I'll be posting some more information about some gross anatomy open lab times, where you can go in there with an instructor present and take a look at those cadavers. But definitely take a look at the models in the lab, because those are definitely going to be a big portion of the practical exam. And good luck. Happy studying.